Hi guys, welcome to series on genes related to neoplasia. So the gene which we are going to see today is the PTEN gene. It's the PTEN gene. Okay, we're going to see about PTEN gene. So we have been discussing about so many genes. So tumor suppressor gene. So PTEN gene is going to suppress the development of tumor. So it's a tumor suppressor gene. What is PTEN? What's the abbreviation? It's called phosphatase and tensin analog. It's called phosphatase and tensin analog, and it's a tumor suppressor gene. Okay, so these are the things which you should remember. So now, how does PTEN gene exerts its tumor suppressor action? So don't get confused by this diagram, just follow what I'm telling. So whenever you have a growth factor which is sitting on a growth factor receptor, so this is the growth factor which is sitting on a growth factor receptor, there will be signaling pathways which leads to transcription of genes, which helps in lot of protein synthesis, which helps in your DNA synthesis and other process involved in cell growth. Okay, this is what normally happens, but this should happen when only when you have a growth factor. So you have different pathways by which your protein synthesis happens. So one pathway is your MAP kinase pathway. The other one is phosphatidol inositol 3 kinase pathway, right? So only when any of these are stimulated, it leads to increased protein synthesis. Okay. So when you want to stop the cell growth, what can happen? You can either suppress your MAP kinase or phosphatidol inositol 3 kinase pathway. So that's what your PTEN gene does. So the normal function of PTEN gene is to go and inhibit one of the signaling pathways which leads to cell growth. So your growth is inhibited, so it prevents the development of tumor. So that's how PTEN tumor exerts its tumor suppressor action, and its phosphatase and tensin analog. So where is it located? It's located on chromosome 10q. Remember 10? So 10. Okay. So whenever you have mutation in PTEN gene, you can have a syndrome called Cowden syndrome. So remember, PTEN gene located on chromosome 10q, 10 and 10. Here again you have 10 and then Cowden syndrome. So what is Cowden syndrome? So in Cowden syndrome, you can have multiple benign skin adnexal tumors. Multiple benign skin adnexal tumors. In fact, that could be a initial clinch to the diagnosis or a suspicion of this syndrome. So you have a lot of skin appendages. You can have tumor from that. So one tumor is tricholemoma. So you can have other tumors as well. So remember, you can get skin adnexal tumors. Okay. Then apart from these, the patients are more prone to develop certain malignancies. What are those? So you remember as PTEN again, make this P as B. So those patients with this mutation in PTEN gene are predisposed to develop breast cancer, then thyroid cancers and endometrial cancer. So that's why we are worried about this PTEN gene. Okay, so to summarize, PTEN is phosphatase and tensin analog. It's phosphatase and tensin analog. It's located on chromosome 10q. It's a tumor suppressor gene, and I told you how it's going to inhibit the development of tumor, right? By inhibiting phosphatidol inositol 3 kinase pathway. Then whenever you have mutation, you can have Cowden syndrome, in which you can have multiple skin adnexal tumors like tricholemomas. Then you can have breast tumors, thyroid tumors and endometrial carcinomas. Okay, so they can develop PTEN tumors. So make this as B. They can develop breast cancers, thyroid cancers and endometrial cancers. So this is about your PTEN gene, and Cowden syndrome is important from the examination point of view, and chromosome number is also very important. Okay, usually they ask PTEN mutations is associated with increased risk of what cancers? Endometrial cancers. That's what usually they ask. Okay, so this is about the PTEN gene. Thank you.